Hi there, and good morning. My name is Riley Satrowski, and I am kind of here to talk to you guys about expanding into Iowa. So, as we all know, that's a very big step for our healthcare organization, but it will be a good step, I do believe. So, starting off here, let's just start out with introductions. So, as we all know, healthcare varies from state to state, but we are now looking at expanding outside of just Minnesota and looking into expanding into Iowa. But before we can do that, we need to understand the purpose of each state's reform, as well as what makes them similar and different to one another. Expanding is a big decision within our healthcare, so we want to ensure that two state reforms are similar and good for each other. Each state is unique, and we all know that. So what that kind of means is that each state had taken what they needed to for the reform and made it into their own. And so what we're going to do is we're going to kind of touch base on what's similar and what's different between the two reforms. Hopefully we can figure out if this is a good choice for us. So the goals of healthcare reform is to provide universal access to healthcare for Americans, help control the rising cost of healthcare, regulate the private insurance industry through things like state-based private exchange, improve the quality of healthcare, and lastly, to help make healthcare choices more consumer-friendly and easier to understand. As we all know, the end of the year comes around and we have to try and figure out how to pick out a new health insurance plan for us and our families. Well, the goal overall is to kind of make that more simple and more easy, like for us to understand as regular people. So starting off, we're just going to cover some similarities between the two because as we all know, we're both Midwestern states and we are very similar. And so starting out, some similarities between the two is number one is Minnesota's medical assistance program compared to Iowa's IA Health program. Medical assistance plan for Minnesota has recently revised this year with new limitations, whereas Iowa's IA Health program began just this year in July, which is very exciting. They're both designed to offer services to children, pregnant women, and families with children, elderly, and everyone who kind of needs that extra help when it comes to getting coverage. No one wants to go in for the flu if they don't have health insurance because we all know that'll cost an arm and a leg. So making sure that our patients are covered and our citizens in the states are definitely covered is going to be our number one priority. So the next one is going to be healthcare quality. So what that kind of means is that each state has a department that is employed for quality control and to ensure that all facilities are within the guidelines for healthcare quality. So what that kind of means is that each state has what is kind of called Joint Commission. What that means is that we have groups that'll go around to each facility and kind of ensure that, you know, the hospital rooms are up to date. We have all new instruments. Everything's been cleaned. All employees know where the fire extinguishers are. Just kind of things like that. We want to make sure that our patients are aware, or not our patients. We want to make sure that our facilities are up to date and that we know kind of what's going on. And lastly, we have electronic medical records. And each state has an incentive program. So what that is that, so Minnesota here has an EHR incentive, which is Electronic Health Record Incentive Program, which is a program that provides an incentive payment to certain healthcare professionals and hospitals that meet specific eligibility requirements when they adopt or implement and upgrade and meaningfully use certified EHR technology, so electronic health records technology, whereas Iowa is promoting a program that is playing an important role in establishing critical health information technology in adults with disabilities and children with disabilities. So that kind of means is that both states are using their electronic health records to the top of their abilities. Minnesota's using it more so to have an incentive for different providers, whereas in Iowa we are using it more so for technology for people with disabilities so that way they are able to access their electronic health records. As we all know that with similarities does come differences, which it always sounds scarier than it really is, and no one likes that, but we do need to touch base on just kind of some differences between the two states. So starting out is going to be the different aspects of whole person care. So new healthcare reform is in Minnesota has been working on designing a behavioral health home model which will operate under a whole person philosophy and assure access to and coordinated delivery of primary care and behavioral health services for adults. and children with serious mental health issues. So here in Minnesota, we're kind of trying to focus on mental health and making sure that not only are we protecting you on the outside, but also in the inside. A lot of times we do forget about mental health, and we make sure that we do realize that that is also just 110% still a part of everybody's life. So then we also have here in Iowa, we're health homes, which is kind of the same as Minnesota, but those are going to be patient-centered, which kind of means that they are going to be coordinated care for all stages of life and transitions of care. A model of care where Medicaid members with multiple or chronic conditions receive help that integrates all their needs into a single plan of care. What that kind of shows is that in Minnesota, for whole health care, we are also looking into behavioral health, whereas in Iowa, they're more focused on end-of-life care. So it goes kind of both ways. So one is looking at mental health, and the other one is looking for chronic illnesses, end-of-life care. Obviously, we want our grandparents to be comfortable and everything like that, and that's what Iowa is going to focus on. Then we also need to remember the PTSD of soldiers and everything like that, and that's what Minnesota is focusing on. So together, hopefully, we can kind of become one. So another difference that I found to be very significant between the two states is going to be the cost of healthcare. So as we all know, Minnesota's healthcare costs an arm and a leg, and it has definitely shown that it is an increase in the amount of money. So a patient at a hospital in Iowa, the median cost is around $3,190. Whereas in Minnesota is over $4,000. Can you believe that? I mean, think of your grandparent going in for an appendix, or they have some chronic illnesses or something like that. I mean, you're talking over $4,000. That's more than a home mortgage. So that can definitely be seen as a difference, not only in inpatient setting, but also it also goes for an outpatient setting. So in Minnesota, a clinical visit can range around $1,200, and in Iowa, it's around about a little over $600. So imagine going in for a broken arm or a leg, or you're coming in for your common cold. You're going to be charged $1,200 in our state and $600 in another. So we're going to have to look at kind of making that into a more even ground, because that's just not really right. So then lastly, we have e-visits. So a patient, so in both states, we have the option for our patients to be seen via a computer or phone. Only in Minnesota has taken the initiative to add it into their reform. For Minnesota, they have what is called e-health, and as part of a health reform efforts at a state and national levels, e-health has emerged as a powerful and expanding tool as for us to provide care for all of our patients. So as well as expanding into Iowa, the strategy to increase access and transform care delivery to improve patient experiences and health outcomes, eHealth also supports the exchange of information necessary to advance a learning health system, which utilizes the information and collaboration to continually improve population health. So what that kind of means is that it's kind of a big hit in Minnesota with the new generations being so tech savvy. So we're definitely going to want to expand into Iowa with our new e-health reform, because that gives our patients access to, any health information or any resources that they may need at any hour of the day. We don't want to restrict our patients to only getting care from, 7 a.m. to 4:30, because that's not fair to our patients. Some people work nights, some people sleep days, So we want to make sure that we're having the care available for all of our patients. And then lastly, we just need to kind of look over, is this a good idea, We don't want to be expanding into a state where we feel like it's not going to be okay or anything like that. So overall, this would be an amazing opportunity for our company to expand into Iowa, not only to offer some of our patients their more access, but also to allow us to grow throughout the U.S. Even though we will have differences when we begin the expansion, I do feel in the end it would be a positive thing for Rasmussen Healthcare System to expand into Iowa. Not only that, but as we know, people move and everything like that. So we do have Minnesotans down in Iowa who are, going to school there, working there, their family moved there, anything like that. We want to still be able to offer them services, even though they're not here with us in Minnesota. as Rasmussen Healthcare Systems, this would be a really good move for us because having that resources, also as Iowa has their differences, we will be able to kind of exchange differences and similarities and make us into a really good healthcare system. So with that being said, if you have any other questions or concerns, please feel free to reach out to me. Or also your supervisors, they can also reach out to me as well. But yeah, so overall, have an awesome day, and if you have any questions, reach out to me, okay? Thank you.